Okay. Well, Dr. Margaret, thank you so much for being on the show today. Would you mind sharing a little bit more about yourself with our audience?
Of course, I'd love to, and thank you so much. I'm honored, actually. Well, have not had the most traditional path to becoming a clinical psychologist. I've been a psychologist now for almost 30 years, but I was actually a jingle singer in my 20s. I sang radio and television commercials in Dallas, and then I had a group that sang at night, and did that for 8 or 9 years, something like that. And then I had started volunteering at the battered women's shelter in Dallas, and I loved it. And I really was ready for a change. Performing maybe sounding kind of sexy and all that stuff, but living that life is really difficult. So I transferred my energies into getting a degree in music therapy, which led me into an internship at a psych hospital. And I thought, oh, no, 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 this is what I want to do. So I actually had to go back and get psychology hours because I didn't even have a degree in psychology. And I almost said I auditioned. I interviewed with University of Texas Southwestern Medical School, and lo and behold, I think maybe out of curiosity, they let me in. So yeah, it's been and then so I did that, and then I've been a psychologist, and now I'm an author and podcaster, and so I'm just really, I mean, so far the ride has been great so far.
That is amazing. Dr. Margaret, I think we have more in common than we realize. This
Ah,
is gonna be fun.
good.
Um, so I am very excited to have you on because as someone who sort of overlaps into the area, the sort of what we're going to be talking to you about a lot today,
Sure.
I think it's very interesting, sort of the work that you've been doing. I can't say that I've fully read your book yet. I'm getting into it, but I am so passionate about sort of a lot of what you talk about in relation to hiding depression and really what you refer to as sort of the concept of perfectly hidden depression and its link
Right.
with destructive perfectionism. I'm really going to jump into this because we never
Okay.
have enough time with people and I really want to pick your brain. So
Got it.
can you tell us more about this concept and really kind of digging into how that differentiates in sort of this whole realm of depression and sort of what you've seen, where your work has really lied in that area?
Sure. I want to say first and foremost, I never wanted to write a book. I had no plans to write a book. I love being a therapist, and I was just fine seeing people. But I wrote a post for my blog called "The Perfectly Hidden Depressed Person Are You One" back in April of 2014, and I was shocked. And I was just really talking about some people that I had seen as patients who, when they walked in my door, did not they would in fact deny that they were depressed. No, I'm not depressed. I've got a great life. I'm just here because I'm a little anxious, or I'm here because I'm struggling with eating or something. But I wrote that post, and I was shocked to find that it went viral, and I never had a post go viral before. And I was writing for the HuffPost at the time, and they featured it, and I got hundreds of emails in 24 hours. This is me. It's like you're inside my head. So, to make a longer story shorter, I spent the next 2 or 3 years really researching what's out there about perfectionism and when it becomes destructive. And I found Dr. Brene Brown's work. Of course, it's wonderful. I found Terrence Real's work. I don't want to talk about it, but I didn't find anything that was stressing that a certain kind of perfectionism, not just striving for excellence. That's a great kind of perfectionism. That's focused on process, and it's fueled by curiosity and generosity and creativity. But there's a thing called destructive perfectionism, which is all about accomplishment, task orientation. Um, you constantly have to meet the expectations of others around you, and I mean all expectations. But what I could not find in the popular literature was any kind of reference to the idea that that kind of perfectionism actually can be a camouflage for emotional pain, that actually you may have suppressed that pain for so long that you're not even conscious of it anymore. When you're 2 or 3 and you're an abusive home or neglectful home, or you're told to go to your room until you can be happy, or you're the star of the family and you must accomplish, all that emotional vulnerability just gets hidden and it stays silent. And you can do that so habitually that actually by the time you're 30 or however old you are, you just say, oh no, I'm just a happy person. If I started crying, I'd probably never stop, but I don't want to do that. And you've got this big smile on your face all the time. And if I asked you if you were depressed, no, I'm not depressed. So what I learned from that was that that kind of camouflage can become heavier and heavier and heavier because you are lonely, you are despairing, and only at very quiet times does it begin to come into your consciousness that that's what's going on. And the tragedy of it is that as perfectionism rates go up internationally, so do suicide rates. And in fact, I bet everybody listening to this knows someone who died by suicide, who died by their own hand, who everyone went, what? I just saw her 2 weeks ago. She looked great. Or, he was my son's soccer coach, and he was always so bright and so happy and so caring about the kids. And it's a highly perplexing kind of issue until you realize that these people have been silent for a long time about what's really going on, and they do not know how to express their vulnerability. That was a very long answer, so I hope that was okay.
And it was a very powerful one. And I'm sure there are so many people listening going, wow, I can relate with this, right? Like, and I think the term camouflage really resonated with me with what you were saying, because you don't necessarily see it. You see all the positive and you're like, no, this couldn't possibly be destructive, but over time, how destructive it truly can be. So, I know you mentioned just the increase in, when you see more of this, of course, then you also see the increase in suicide. Why do you think or how do you think the mental health field is really kind of overlooking this dangerous presentation of this? Because it's getting missed, right?
Yes.
And so
Hugely
what's
missed.
happening here?
Yes. What is happening is that we have become very operational in mental health. And when someone walks in our office, we have these criteria that must be met for depression to be diagnosed. And if I took that classic list of symptoms, people with perfectly hidden depression or who experience life like that do not meet criteria. The two major criteria are a depressed mood that is evident to either the person or the person's family or friends or workplace. And so it's a noticeable change in functioning from the way they normally function. And the second criteria is what's called anhedonia, which is the lack of pleasure in previously it's hard to say, the lack of pleasure in previously pleasurable activities. And so, someone walks in your door and they're smiling and they kind of go, I don't know really why I'm here, but I've heard you're a good therapist and I thought maybe you and I could talk about some things, and they're smiling. And this actually happened. I asked this patient if there'd been any sexual abuse, and she said, oh, no. And the second session, she came back and she said, well, you asked me about sexual abuse. And again, smiling. I was raped before I went to college, and I don't even think about it anymore. I didn't even tell anybody. And it was such a long time ago. I don't think it matters. And I have to look at her and say, did you hear what you just said? That being raped doesn't matter. And to them, it has been so compartmentalized. It's been so pushed away, so repressed, that it truly is not a big deal to them because they don't know how to let it be a big deal. They're so afraid of expressing that vulnerability. They need to stay in control.
Absolutely. And what a powerful example. I actually remember you mentioning that in another interview. And I just sat back and I was thinking to myself too, with others that I've worked with, how many parallels of so many repeated stories that are similar. And then, like you said, if you were to just turn down your audio and watch you, I think you said you
I
would
did
look like you were talking about a great
ordering
time
lunch.
you had last night,
Yeah,
or
yeah,
or ordering
exactly.
lunch. Does
And
that sound congruent to you?
and I will say, in clinicians' defense,
Yeah.
they will say, well, if someone doesn't tell me what's wrong, then how am I'm not, I don't have a crystal ball. And my answer to that is exactly what I said in the book. The answer to that is, if you're aware that when perfectionism is present, when some of these, what I call the 10 traits of perfectly hidden depression, when those things are present, it's a syndrome of behaviors and beliefs that hang together. It's not a diagnosis. Then you can think outside the box. You can think, isn't this person, their lives are a little too perfect, or they seemingly really can't express or not able to talk about painful emotion at all. They just kind of lighten it up and discount it or even deny it. So you're so right, Angela. I think there are a lot of our patients who are like this. Now, let me make a quick differentiation. There's a thing called high functioning depression or smiling depression that has been written about a lot, especially on things like on websites like The Mighty, and people who really are talking about some of their, really trying to explain what's going on with them. I think someone who has high functioning depression would hear about perfectly hidden depression and think, well, that's me. And I get that. In many ways it is. But this is the difference. People with high functioning depression know they're depressed. They know they're depressed. They're in treatment. They're on medication. They make sure they get lots of exercise so they don't get sad. They have seasonal affective disorder. They've learned how to cope. They're not so depressed that they can't get to work or take care of their kids. But this is different. This is truly something that is, again, I'll use the word, Allison, that you like, that camouflage, that it is, it's something you strap on every day, and you really don't do it consciously. It's just who you have become. And the wonderful, incredible work that these people can do in therapy when they begin to let down that camouflage is amazing. And it takes a lot of courage. It takes, you're very afraid when you're dealing with this, that you'll lose your job, you'll lose your status, you'll lose who people think you are if you admit to being overwhelmed or fatigued or bored or whatever you are. That if you really allow yourself to begin to be more transparent, that your world will crumble.
Absolutely. I'm really glad that you also pointed out that differentiation between high functioning depression. I was actually, talking with some colleagues the other day, and one of the things, and you also bring this up, is, because in, psychology, psychiatry, we do have this tendency to utilize a lot of standardized measures and scales ad nauseum, right?
Right.
There is such a, it's such a challenge then to be able to give people the language that they need, which I think you speak to so much. And I want to hear a little bit more about this in terms of how you would give them these tools and help us sort of look inside and see how we can better equip ourselves and those who want to help us, right, with more of these symptoms, or, the terminology around what we're actually experiencing that doesn't seem to, hit the notes of when you go in and you talk to a psychiatrist, or you go in and you're being assessed by a psychologist. What they're asking you doesn't hit that note for you. You don't relate to that. Yeah. Right. And so we know you've written a lot about this, and don't want to be a spoiler for your book, but can you give us a little bit more in terms of how we can help ourselves and others around us to really identify whether or not this is something that we're going through?
Well, the heart, sure, I'd be more than happy to do that. The interesting thing about perfectionism, it's sort of like an eating disorder, to convince someone that their thinness is really about an eating disorder is very difficult, because that eating disorder has become their best friend. Perfectionism is very much the same way. Perfectionism and taking lots of responsibility and being in emotional control and focusing on other people. It's so easy to convince yourself, well, there's nothing, what is she saying? There's something wrong with me being going the extra mile and being a nice person and working hard, working diligently. I don't see anything wrong with that. And so the first step is literally to say, but wait a minute, who actually knows me? Maybe even my partner doesn't know me. Who do I let in? I had, as I wrote about this, guys, and tried to think about what is this thing, I would ask for people to volunteer and to please talk with me and to email me. And I was amazed, in about 3 months, I had 70 to 75 people reach out. I had to filter out some of those, but I did 60 interviews, hour and a half, 2-hour interviews with all those people over about a 6-month period of time. And what they all told me when I asked, well, why would you take a risk? You're in your garage, so no one knows you're talking to me. You're locked in your office, so nobody knows you're talking to me about your perfectionism and about your pain. And I said, why would you risk contacting someone that you just read a blog post by? And the most common answer was, I do not want anyone else to live the life I've lived. I have been so lonely, and I feel so trapped in this perfect looking prison that I've created. And I get suicidal, or I've attempted suicide. So I think that, that is a huge step in this, I hate the word journey, but anyway, in this healing process, because it is hard to admit that something you counted on as much as, you being the person who's always the go-to, who always gets things done, and to begin to shift that thinking into something that's a little more human is hard. And so it takes a lot of honesty with yourself. And what I hope people are hearing is that they will recognize that they are lonely, and that that sense of emotional intimacy that they see other people have, that they do not have that.
So powerful. I mean, everything that you're saying, like the perfect little prison, right? Like I've heard people use similar references of like, okay, from the outside looking in, everything looks amazing, but on the inside, it's the loneliest place you'd ever want to be. So I'm sure there's a lot of people that right now are saying, oh my gosh, you nailed it. You totally identified what we've been feeling for so long. So
right, Allison,
really.
I have been, I'm sure every author who ever writes a book believes their book is important, or you wouldn't have had all the angst that was probably in your life to write it. But, this particular message was so important to me to get out there. And I'm still trying, and I so thank you for, you inviting me on. And so your listeners can hear about this, because it's tricky. It's tricky to realize that there are paths out. My book does have 60 exercises in it that are meant to take someone very slowly and carefully from sort of this begrudging curiosity about, okay, let me read this a little bit. And so, because it is almost shocking to these people that there could have been something that was in their family environment, in their cultural environment, that caused them to adapt this way. And the very thing that helped them live through that and survive that is the thing that now has grown into this, it's become their taskmaster.
Absolutely. And one of the things I'm curious to get a little bit more info from you, since you've done so much work with others on this specific topic, is, we work with a variety of folks, across gender, occupation. And of course, I'm curious about if there are any trends there that you've seen, because this does hit a lot of notes when I start thinking about people that are in certain positions or roles. But I also don't want to discount to that discussion around, a lot of people only think of pointing out that women have a really difficult challenge with this. But for example, when we think about, and Allison and I work a lot directly with, firefighters, first responders, people who are in the medical world, who are functioning, again, very, at different levels, but this really rings a lot of bells in that area too. So just, can you speak to anything you've learned about sort of that gender component or occupational trends, differences there?
Sure. I'm a clinician, not a researcher, so I haven't researched this myself. But most of the research in perfectionism does show that women tend to, uh, they tend to rate themselves as more perfectionistic than men do. However, my clinical experience has been that my own private practice has attracted just as many men to talk to me about this as women. And I think ethnicity is, of course, so important. And there are cultures that, being men in a certain cultures, being male, you're not supposed to be vulnerable at all. And certainly in families. And so, in fact, one of my African-American patients said, she was reading the book and she said, Margaret, in my family, if I wouldn't have gotten the opportunities that I did, if I weren't not only perfect, but better than everybody else. And you're asking me to consider that as something that is self-destructive now. And I said, yeah, I am. And she said, but it's so hard because it's so built into, I'm the generation that's supposed to do better than any other generation before me. And she said, I've lived my life that way for 35 years. And I said, I know. And so let's just tweak it. You don't have to throw away what was that old saying, the baby with the bathwater or something. Just say, okay, what works for me? In fact, the book talks a lot about the things that the actual stages of treatment. One of them being that you really want to look at the absolutes in your life, the rules you're following, the musts, the shoulds, the have tos, the ought to never, and begin to say, well, which one of these does still work for me, but which does not? Or I'm uncomfortable with thinking about changing it. Well, why are you uncomfortable? What's going on that would make you uncomfortable? There's that work that's more cognitive behavioral. And then there's the work of really going back and looking at your childhood, the family, the culture, the region, whatever, the country, and to see how the events of your life, both good or beneficial and painful and harmful, began to form patterns in your behavior. How, going back and acknowledging with compassion, yes, this happened to me when I was 3, or yes, this happened to me when I was 7, or whatever. And some good things and some harmful things. I'm so much more comfortable in remembering the good things, and how could I begin to honor and acknowledge the pain that was caused me by a grandfather, or being bullied, or going having 8 different schools in 9 years. What is it that was hard for me and that I began covering up by just being highly achieving and caring about others and focusing on others, not on myself, and, counting my blessings to the point where it's toxic. There's a toxic positivity that's out there. Dr. Susan David talks a lot about that. And she calls it a tyranny of positivity, in fact. It's like, anyway, these steps they're hard because it really does turn some of what you believe upside down. But I have had people say to me, I feel so much more free than I did before. My personal definition of self-acceptance, which I've had to work hard on because I made a lot of mistakes in my life, especially when I was doing that singing thing. Ooh, that was not good. And so, to me, self-acceptance is really claiming that your strengths nor your vulnerabilities define you, that they both exist. And they are facts about your life, and neither one of them define you. And I think that's where people, in fact, I say in the book, self-acceptance is the antidote to perfectly hidden depression.
Wow, I love that. So,
There you go.
no, that's really powerful. So many things that you've offered nuggets of wisdom throughout this entire episode. I am curious if you've seen any impact of the pandemic on individuals that are struggling with this.
Oh, yeah. We all get out the strategy that we use the most when it comes to increased stress. Even if I had learned a new skill, the example I like to use with my patients is that, if I was really great with a knife, no, let's say if I was really great with a bow and arrow, but I just worked on my knife skills, and if a bear came roaring after me, the knife might be better, but I'm going to pull out my bow and arrow, right? Because that's what I've counted on for years. During the pandemic, people have used the strategy that has best worked for them as their lives have gotten more and more ambiguous, more out of control, financial issues, obviously health issues, fear for your children, fear for your parents or grandparents, our environment. I mean, it's just been chaos. And so my guess is, and my concern for these people that I've written this book for, is that they got out there. Well, now I'm going to be uber perfectionistic. I'm going to be the person that checks on my neighbors constantly. I'm going to be the person that, is volunteering at the school, or I'm going to be taking, none of that is bad. It's just when and how do you check in with yourself? And when do you sometimes say, I'm too tired to do that, or I need to focus on how this is affecting me? I've given this talk to therapists, and a lot of therapists will say, oh, well, So, serving professions, as you say, the first responders. In fact, I've had people reach out to me on my own podcast who are veterinarians, who are doctors, who are, I haven't done police officers, although I've talked to several. Let me see, who else? Dentists. It's like there's these certain professions where you are, you are trained to not respond emotionally. You're trained to do that. And so, trying to shift between doing that professionally and then shifting into a different way of being personally, that's tough.
Yeah, what a combination, right? For continuing to just dismiss what's
Right.
going on with us, right? And then, like you said, add the pandemic to that. And that's a whole other level of just pushing, drudging through and really not taking that time. I do know, on the flip side of that, I hope, first of all, that this has given our listeners and us a lot to think about, and that we can take that time to reflect. And I do know, some people have had the opportunity to do that, but I think you're right. And especially for the folks who've really hit that front line hard, right? Like they've made that their mission. And that is such a core component of their identity, right? It has been throughout the pandemic, but even more so, as they're building that muscle and then now trying to pivot things as we move through it. So I think, again, this is just a lot for everyone to take in and really think about. So,
some of my friends would say, hey, Margaret, are you disappointed that this isn't your book wasn't although it did reach #1 in suicide one time, but it said, it's not a bestseller. And I said, no, I never thought it would be that way. I would have been, absolutely flabbergasted if that had happened because of the population I'm trying to reach. This is kind of a trickle, and it's, oh, I know somebody who needs to read this. Oh, I need, and that is exactly what has happened. My publishing company has said, we don't quite get this, but we're interested in a second book because your book is selling. It's just kind of selling like, it's not gathering speed, but it's not slowing down either, which kind of is what I predicted.
And I'm sure now that, people are out looking, I think that's the one good thing about the pandemic is that people are actually willing to try to get help more so than they were before. So I'm hopeful that those listening today that are resonating with this or know somebody that this sounds like them, pick up a copy of your book because it's going to be very, very, very helpful. And Dr. Margaret, one of our favorite questions, and we get to ask this of all of our guests that come on our show, is at this point in your life, what matters to you most right now?
Personally,
Anything.
anything. Well, professionally, it's obviously this message, because I've spent now, how many years? 7 years on this topic. I'm 67 years old. And so personally, what matters to me the most is to live my life with meaning, and to be a good friend, to be a good wife, to be a good mother, and to what I like about being 67 years old is that I really get to use so much of what I've learned. And I'm still learning, I'm still curious. So, I want to stay curious. I want to try to help other people remain curious, and to do whatever healing they need to do. And I heal along with them.
I love that so much. What is the saying? The more you learn, and the more you know, the more you realize you don't know. Right. So
Right.
I love it so much. So thank you so much for joining us today, Dr. Margaret. Can you share with our listeners how we can follow you either on social media or find you anywhere else?
I have the very creative name on my website of drmargaretrutherford.com. And my email is askdrmargaret@drmargaretrutherford. My podcast is called the Self-Work Podcast. And it's everywhere you listen, Spotify, Apple, whatever. And of course, I have a Facebook closed group at facebook.com/group/self-work. That's kind of fun. I'm very accessible. So I really do try to respond to people as best I can when they reach out. And I'm just, it's one of my favorite things about this thing I never thought I would do, the book and the podcast, is I get to know people from all over the world, and I've gotten to know y'all. And so, that is just so special to me. It's like all of a sudden my world is bigger. It's kind of cool.
Yeah, we love that too.
We do.
Yeah. Isn't it great?
So special. Yes.
So
Well,
awesome.
thank you so much. We just appreciate all the work that you're doing. And thanks again.
You're more than welcome. Again, it's my honor to be here. And y'all have I listened to your podcast, and you really have a great style. And so you're going to do very well.
Thank you so much.
Sure.